Hi, so my name's Tim, and I uploaded a video on derealization, depersonalization disorder a couple of years ago. It got 70,000 hits, and that really surprised me. And so many people have commented on about how they've experienced depersonalization, derealization, etc., etc. But what I'm here to talk about now is, you know, I've had to deal with other health problems related to anxiety. And derealization is a symptom of anxiety, extreme anxiety. Uh, my anxiety has manifested itself in physical symptoms um, over these past years. 2 years ago, um, I developed headaches in my forehead, and I got blood tests and MRI, and everything came back normal. And they said they really don't know what is causing this headache besides probably anxiety. But even after all the medications they tried to treat it with, nothing really worked, which is just freaking bizarre as hell. So I've had to learn to deal with that, um, and the stresses that come along with chronic pain. And then on top of that, about a couple months ago, I developed probably what would be considered chronic fatigue syndrome, but it really doesn't matter what you call any of these disorders. They're just labels, and everyone's different, and everyone experiences their symptoms differently, and everyone needs to be treated as a person, not just a disease that like doctors just throw pills at, you know. Um, so yeah, I all of this seems to be related to anxiety, like derealization. That feeling is, you know, anxiety trying to protect itself from its own feeling, and it's counterintuitive. Your body reacts by dissociation, and then your body gets anxious because it reacted that way. So it's a cycle. And most people with these symptoms have like obsessive compulsive disorder. And that's what they believe that I have, and that the brain is just wired differently to react in like a circular method to any kind of symptom that you'll experience. Like, um, but yeah, I've had obsessive compulsive disorder and just never really wanted to treat it, and had to pay the price for it because I never really wanted to like admit that it was it, because it's not the typical obsessive compulsive. It's more of just anxious thoughts that are circular. That's what derealization is. It's a circular obsessive compulsive symptom. You experience a feeling of derealization, and then it makes you constantly check if that feeling is still there. And that's obsessive compulsive disorder. You're obsessed about your feelings, and you're compulsed to constantly check on your feelings. So you have to admit that to yourself. But yeah, I've had headaches and fatigue and severe insomnia that don't have clear causes, and everyone in my life is just baffled like by it. And then they don't think that I'm lying. There's just like there's no physical evidence to prove that I feel this way, but I'm pretty sure most people around me can tell that I, you know, struggle to do normal things, but I still went to school and I just graduated with a bachelor's in biology. So it's not impossible. It's just you have to work at it. And anxiety is an extremely underestimated disease almost. Like you could consider it because it can have physiological symptoms like headaches and derealization and fatigue and insomnia. It could just, some people's brains like mine are just wired to be hypersensitive to everything. And since having post-traumatic stress when I was younger, I was in a situation in my own home where I pretty much for a couple years was under threat of being killed every day. So that like constant adrenaline rush that I would always get every day from like the fear just set myself up for a lifetime of being very sensitive to everything. And my mind just as developed just kind of became bottled up with anxiety, and then the only way that my body could release it is through physiological symptoms, dissociating, feeling pain, feeling fatigued, things manifesting because I suppress them. But what I want to do is I want to allow anyone that needs help with anything to message me if they would like, because I do read your comments, and I care, and it's torture. It really is. And it's not something that should be taken lightly. And if you need the resource to uh, find treatment, I would be glad to help you in the right direction and post more videos if this does get hits. But I don't expect it to. So I'm just throwing it out there. Doesn't hurt, I guess.